I think one of my favorite things about inpatient, both as a resident and even as an attending, is just some of the camaraderie we have on that service. It's really fun to get to work with so many of your different colleagues and to get to know the residents and to spend that time. It's also just a great area for learning, especially as a resident. I think you're pushed a lot more on that inpatient service, and I really felt like I learned a ton there. And I don't know that I would have gotten that experience if I didn't go here, if I went somewhere that didn't have quite as much of a robust inpatient service. So I think it really laid a good groundwork for future practice, both inpatient and even in the clinic. It teaches you so much just about full scope of medicine.
I think one of my favorite things and favorite parts of inpatient medicine here at the University of Missouri has to be the variety and the complexity of the patient care that we provide. We see a whole bunch of really sick people and are able to manage those people really well. And with the help of some of our consultants, I feel like we take excellent care of our people here, and I feel like we are going to be adequately prepared to take care of people in the clinics, in hospitals, in ICUs, pretty much all different levels of care.
So one of the unique features, or more unique features, of inpatient medicine here at Mizzou is that our family medicine department has its own inpatient service. And what that allows us to do is develop strong faculty in inpatient medicine. You know, a lot of times at different residency programs, different places across the country, learners will be with an internal medicine service, which is great. You can have a good learning experience there, but not necessarily working directly with family doctors who are practicing inpatient medicine.
We mainly admit patients from our own clinics and that are established with PCP, so it's a nice closed loop system, yes, usually where we know where they came from and we know where they're going back to.
So as of right now, we have 3 teams. One's a PA only team, which has 2 full-time PAs and an attending that staff that. And then we have 2 resident-based teams that have 2 senior level residents and 2 intern residents on each team, and those 2 are paired, which makes it nice to have good communication with your buddy and your residency pair. And we switch call days, so that way it makes it nicer between the teams, and clinic days as well.
And so, of course, there's going to be learn as you do. So pretty much everything is new to you when you're an intern or a brand new resident. And so you're learning the ways around the hospital. You're learning how to interact with the nurses and with the patients, like picking up different ways that you talk to different services and all those things. There's also a lot of more formalized teaching every day. There's protected time, at least 30 minutes to an hour of some sort of lecture or didactic, either from an attending or for our grand rounds. Even sometimes our medical students will give small talks and things like that on inpatient service. And then there's a lot more hands-on learning that happens with our new inpatient team setup, just between senior residents and interns. Ideally, we have it set up to where all of the patients on a team are split between the 2 interns who are the primary caretakers for them, and each of those interns kind of has a senior that is there either taking patients if there's too many for the intern, or there to answer literally any and every question that you can have for how we take care of this patient here in the hospital. And so I really like the new team setups that we have. I think there's a lot of opportunities to learn from people who have more experience or people who have been doing this for a little bit longer in a lot of different ways.
On our inpatient service, you will get to see standard inpatient conditions like pneumonia, CHF, and UTIs, cellulitis, pretty bread and butter conditions, but you'll also get to see a lot of very rare conditions. You'll get to work with the team and the attending to come up with a wide differential and really dig in with the help of consultants to try and figure out what is going on. And that's probably one of my favorite parts of being on inpatient, is really trying to come up with a treatment plan and thinking of what else could be going on and what's the most appropriate thing for the patient in order to treat their condition.